Hello, everyone. Thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller from the Department of Psychiatry. Before we get to our presentation, I have important information to share about the program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to your nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties, express or implied, with regard to the information provided herein or to its use. We are quite pleased that you've joined us today. Please take note that additional resources are available at the Loop on the hospital website. Our presenter today will need no introduction to most people within UIHC. She is Dr. Theresa Brennan, the Chief Medical Officer at University of Iowa Healthcare. Dr. Brennan is a clinical professor and a cardiologist by training. The topic for today is leading in a time of crisis. During her presentation, Dr. Brennan will impart some wisdom and practical suggestions for leaders at all levels who may be feeling stressed by different aspects of their jobs in this challenging time. Here to tell you more without further ado is Dr. Brennan.
I think we've seen from these forums that the value of self-care and wellness and surviving in the stress of this crisis of COVID-19 is so important. The previous forums I've looked at and have been very impressed. They've been delivered by people I would consider experts. I just want to say from the beginning that I'm not an expert on wellness, but I would like to share with you today the experiences that I've had and what I've learned throughout my career, and really more importantly in the last 4 months about how to lead in a time of crisis or a time of uncertainty. What we know is that employee wellness is heavily influenced by their supervisor, and we know that people leave jobs more commonly due to poor leadership than any other factor. Therefore, it's so important that good leadership is something that we strive for, or great leadership is something that we strive for, but particularly in times like today, when there's change, when there's challenges, particularly unusual challenges, or even a crisis, good or great leadership is really essential. So I'll share with you the things that I've learned. Again, I'm not an expert on this, but I have learned a lot, and I feel like I've learned a lot just by being thrown into the COVID situation, and I've learned a lot by people that I'm surrounded by. I'm going to focus on 3 areas today that I think, from my perspective, are pretty important. The first is how you take care of your team. The second is the importance of being a role model. And the third is really that you have to take care of yourself. If you're going to take care of others, you really have to take care of yourself. So I'll start by talking about how you take care of your team. I think in order to take care of someone, you have to know them. And in an institution this big, it's hard to know everyone. But I think trying to get to know people, really recognizing what their struggles are, is a great way to start to lead and to affect change that is really necessary. During COVID-19, there have been so many emotions. The first is a lot of confusion and concern about the future. I've said before that the one constant during this COVID-19 outbreak is change. And most of us know that we don't really, as human beings, like change. I mean, we get into our habits and we get very comfortable, and change really can bring on a lot of anxiety. And then you add to that crisis situations where anxiety, feelings of fear, and really those concerns about what's going to happen to me really fill all of us. I think COVID-19 has been a really unusual time of crisis. As a leader, I think about how we care for our faculty and staff every day. But most of the time I think about how we make their job easier and how we make sure that they can take great patient care, take great care of our patients. I always think a little bit about their safety, but this has really taught me that thinking about all of our safety is so important, and it has really become a focus of the things we do, how we make sure that we are taking care of our people and keeping them safe. And I think that's what people expect from us. I also think that in order to do that, you have to recognize that these feelings have an impact on people, and it may cause people to withdraw. It may cause others to act in ways that they don't normally act. We all deal with these sorts of stressors in different ways, and I think it's really important to recognize what the stressors are and recognize what the impact they're having on your people. I think being engaged, I'm going to say I think a lot because this really is all about what I think about each and every day. So I think that being engaged is so important. One of the things that my team has done during this COVID outbreak is to have a lot of routine Zoom meetings just to get together and to talk to each other about how things are going, so I can be engaged in what's going on with my direct team. I think it's also important to be visible. People want to know that you're in this with them. We talk about this all the time when we talk about we're in this together. And I think the only way that we can be in this together is by being together. It's a little hard with social distancing, right? We have to go away from our human tendencies of being close together, but making contact with people. And, I think Facebook is a great way to do that. Zoom is a great way to do that. So keeping in contact and being visible is really important. And then I think it's really important to just be human. It's important for all of us to recognize that each of us is going through these same struggles, but some people it may impact more. And recognizing those emotions and having that human compassion is really important. We've talked a lot about the safety standards that we've put into place and how sometimes people aren't following those safety standards. And what are you supposed to do when that happens? We certainly want people to follow them, and certainly it could get to a point where you have to use discipline or other things, but that's really not the way we want to manage this. And I think approaching someone with kindness and compassion, hey, you're not wearing your shield, that's really for your safety, and I really care about you, and I want you to follow those safety standards so you can stay safe, is definitely a better human way to deal with it than marching down a disciplinary path. I have had conversations with some of my people about working at home, some of the people that work with me about working at home. And I think one of the things that I've learned is that when things are changing, we as leaders need to be thoughtful about what those changes are and how they have downstream impact. And then we kind of think we know really what's going on. But I think it's really important to verify with the people that you're leading or the people that are around you that what your thoughts and expectations are actually correct. And I actually had an interesting conversation with one of the staff that works with me who's working from home. Some people think working from home is great, right? I don't have to do my hair in the morning, or I don't have to drive to work and go through the parking and now go through the screening, which is different from my normal. But what I heard from the staff member was that there are some downsides to working from home. And one of them was work-life balance. And what she told me is that, sometimes she'll find herself caught up in work and, it'll be 6:30 at night. And, that's not her normal stopping time. And then when you work from home, it's a little bit difficult to separate when you're working from home, when you're working versus when you're not working. So that was really a light bulb for me to recognize that, I come to some of my own conclusions, and I think I'm right because I evaluated them and I was thoughtful about them. But there are other perspectives. And I think that flexibility of recognizing that what you think is going on, what you think is right, is really necessary for you to have the ability to step back and take a breath. And particularly in times when there might be disagreements, to take that breath and to just try to be an unbiased person and look at the what's in front of you in an unbiased way, and not, be really committed to what you thought about in the beginning. So be thoughtful about people, about processes, and then verify, because sometimes what we think isn't right. I think communication is another part of taking care of your team. Silence is tough. When you're not hearing from someone, that's almost worse than hearing something that you don't want to hear. So communicating is really important, and probably in the time of crisis, it's even more important than it is every single day. I think when you're communicating, it's important that you kind of dig deep into things and make sure that what you're talking about, you actually understand. It's important that you speak about what you know, even if you feel like it might not be the right time or things aren't formed enough for you to really talk about them. I think that communication is really helpful. And I learned that a lot during COVID. I learned about how when our first patient arrived, how at Suresh's request, we communicated with our staff before it was out in the media. And I think that that's really important, to make sure that your timing is on. And admit when you don't know something. I think the worst thing you can do is guess. It's okay to say, I don't know, but I'll get back to you. I'll try to figure it out and I'll get back to you. When you guess, and people perceive that that's real, and then it's not, you might be perceived as not being quite honest. And I think honesty in this time is extraordinarily important. Sometimes we can't share things because things aren't ready for public dissemination or widespread dissemination. The timing's off, or things haven't been thoroughly thought out enough that we can share them. And when that's true, just be honest and say, we're working on that, but I really can't share that now because it's not ready to be shared. I think that the most important part of the whole communication that I see is communicate frequently, over-communicate, communicate in multiple modalities, and make sure that you're communicating the right stuff. Try to recognize what people need and communicate that, but be honest. Losing your integrity, I think, is, for me, probably the worst thing that could happen. So, make sure you're honest, and when you're not, or when you make a mistake, own up to it. I think really important that we have the humility and the genuineness to be able to say that, I made a mistake. I should have done something different, or what I told you wasn't correct. This is the correct answer. Or this is the correct statement I should have made. I think that honesty really goes a long way. I think it's important for people, but whether you're in a formal leadership role or whether you're taking on an impromptu leadership role, that people see you as a humble and honest leader that's really in it for the good of everyone. I've thought about a lot how being a leader in this institution carries a lot of responsibility for quality care, for finances. But this crisis really, for me, has been very personal. I think the idea that our people could be impacted, and in a really bad way, by getting this virus was really a driver to make sure that we address the safety concerns. And I think when emotions are so strong because of concern about your own personal safety and the impact that has on you and your family, you can't minimize things. You have to address each and every concern that comes forward. And, I'm really happy that our leaders have really participated in the use of the blind spots portal. So you can submit something and someone actually gets back to you saying, we looked at this and this is what we're doing, or that was a great idea, we'll think about it, or we can't do this right now, but it was a great idea, we'll continue to keep it in the parking lot. I think it's also important that we initiate conversations with people. When you're walking around the hallways, I make it a point every night and every morning when I come in to say hello to people. I think that that's really important to be that servant leader, that, you're here for them. I also think it's important to be responsive, and this is something I personally struggle with. I get lots of emails, and I try to keep my emails up to date, but it's hard. But I will tell you, in the first several weeks of COVID, I made a point of making sure that when someone sent me something, that I responded to them. And sometimes they were emails of gratitude or emails that were really designed to support the leadership, and even just a short thank you, and this means a lot, I think is really important. So initiating those conversations when they're not happening, I think is something that we as leaders maybe sometimes don't do as well. And in times of crisis, that human connection is so important. And then the last thing I would say is really be thankful. Thank people. Let them know that you appreciate what they're doing. Make sure that they recognize that you support them and that you're grateful for having them on the team. I think we all need that when these crises occur. The last thing I'll say about taking care of your team is I think it's really important to recognize the talent around you, and as a leader to give opportunities to people who rise to the occasion. I have seen leaders develop quite rapidly actually during this outbreak, people that have leadership qualities but maybe hadn't been in a leadership role, or even people who have been in a leadership role who I've seen as good leaders become great leaders. And I think that we should allow that to happen, even spontaneously. Someone might step into a position of helping out with someone and then become that leader just in that moment. I think it's really important that we recognize those talents, and that'll serve us well going forward. So take care of your people. The second thing I wanted to talk about is how we have to, as a leader, be role models. And, I've used the word leader a lot, but I think it's important for all of us to recognize that even though you might not have a title that, says something about you're a leader wherever you are, you may be viewed as a leader. People may look to you as a leader because of what you do, how you act. So if you aren't in a formal leadership role and you're listening to this, think about the times when you've made an effort and rose up and led a group for a period of time, or where someone's looked to you for advice. Those are times when you can be that leader. As you are a leader, we talk about walking the walk and talking the talk, and that I think people are pretty much in agreement that if a leader is going to ask someone to do something, they should definitely do that themselves. But I think that it's important to do that sincerely. One of the things I'll talk about is coming in and going out of the institution. So when COVID first hit and we were identifying designated entrances and exits, we have a back door in hospital administration that I routinely have used to come from the parking lot. I come in the back door, I'm right by my office, it's great. And although it's out of the way for me to come in a designated entrance, I'm following the rules. And I think it's really important that I do that because it doesn't show good integrity if I'm asking everyone to do something and I'm not doing it myself. So, people probably wouldn't know if I did that because, I'm going behind buildings and it just wouldn't be apparent. But for me, I would know that, I'm not doing what I'm asking people to do. And I think that sincerity, it goes even beyond those sorts of things. I mean, it's, having conversations, I tell somebody to do something, but in a conversation, I'm showing that I'm not doing it. Or I just think it's really important that if you want to be viewed as someone who's a leader, I think you have to sincerely follow the rules. And it's not just for the big things. It's for the everyday things too, just like coming into work. As you are a rule follower, I think you have to be honest, not only with the people around you, but with yourself, that people see what you do. And if you're going to be a valued leader in the organization, I think you have to follow rules. You have to be honest. And you have to value that integrity of being that person in a sincere way. I think even more now during this crisis, leaders are under a microscope. People are watching us, and they're looking for us for guidance. And when we fail to do what's right, it kind of opens up an opportunity for others to do the same. So I think we have a big responsibility. I think as a leader and a role model, no matter where you're leading or what your role is, you need to empower yourself to make a difference. People talk about, I can't do this because I'm, no one's given me that authority. I think, we've seen in COVID that people have been empowered to make a difference just by rising up and taking on things. And you don't necessarily have to have a title to do that. I think it's important that you also allow yourself to go beyond your normal, take a risk. Staying the same and doing things the same during COVID is just not an option. And honestly, in healthcare, it's probably not an option most times. We need to continue to improve, and that involves really taking a risk and being flexible. Give people a reason to trust you by being that role model. And then I think the last thing I would say about being a role model is remember that it's not about me. It's about the people that see me. You can make a leadership role about you and how this is going to help you and you're going to advance because of it, or you can do that job just to make a difference. And that's how you remember that it's not about you individually or me individually. It's about making it better for the institution, the organization, the team you work on. The last thing I want to touch on is just about taking care of yourself. And I think those of you who've been watching these forums have seen a lot of really great stuff on how you can take care of yourself during these times of crisis. I think as a leader, you have to remember that too. And that can be hard because, early on when COVID came, we were all into it for long hours, weekends. It was all about COVID. I remember telling people that I would go to bed at night thinking about COVID, and I'd wake up in the morning thinking about COVID, and it kind of consumes you. And when you're in that situation, it's hard to be able to be a good leader and to take care of others if you're not doing a good job of taking care of yourself. During these times when you're trying to lead and when chaos is happening or crisis is happening, it's really common for us all to have emotional swings. And when those are apparent to others, it doesn't really inspire a lot of confidence or let people believe that you as a leader are going to be reliable and are going to be able to make the best decisions for them. So fatigue really leads into that. And if you're not taking care of yourself, you will be more fatigued, you'll be more emotional, and it'll result in things that maybe you would do that you don't normally do, actions and gestures and words that you wouldn't normally use because you're just tired and things are just harder than they normally are. I think it also, and Emily Ward talks about this a lot, about how when you hear things, you then kind of make up the rest of the story, how that's a natural human instinct. You have pieces of information, you fill in the blanks to make the story, and then you kind of believe it, even if it's not true. That sort of jumping to conclusions, I think, is common, and I have found myself doing that. And I think that's when, that take a break, step back, take a breath, try to look at things and with an eye that is not biased, is not filled with the thoughts that you have been thinking. I think it's really important during this outbreak and at many other times to be connected to those people you love. I think we think about these when we lose someone close to us, but I think it's important all the time. And I think that's been one good thing that's come from COVID, that, I think people are connecting, whether it's by Zoom or other means, probably maybe more so than they used to because they don't have that face-to-face connection. I have seen a lot of silver linings in this COVID-19 outbreak. I've seen people rise up. I've seen amazing things happen. I've seen good things come out of what is really a terrible thing. And I think that if we all try to look for the good wherever it is, that we'll find it each and every day. There's always goodness in our days. And if we don't focus on the positive, we'll find ourselves wallowing in the negative. And I think even more important when we're in times of crisis, we have to really focus on what is good and what is positive, and really not let ourselves, kind of fall into that negative. I think sorry, I thought I closed my Outlook, but I apparently didn't. I think that it's even more important at this time to have a trusted confidant. If you keep things bottled inside, it's eventually going to cause you to just not be good. So having someone that you trust, who you can talk to, and for many of us in healthcare, that's hard because we tend to talk to our partners or our spouses, and they get the weight of everything, and that's probably not really fair. So those people can be very valuable in your life to help you to focus on the positive and continue to move forward. But sometimes having someone who understands what you're talking about better might be more helpful. Someone perhaps who knows what's going on in your work life, or what's going on in your individual area. Make sure that that's someone that you can trust and be honest with. And I would say also make sure it's someone who's going to tell you the truth, because you want that person to help you to be better. Help you to solve problems, not necessarily to just tell you what you want to hear. I can't really over communicate the importance of having someone like this, because though that person can be your support, they understand perhaps, but they're honest with you about what you're dealing with, and maybe what the best next step would be. The last thing I'll say that is really important to me and to many people is having faith and holding to your values. When leaders are making decisions, there's little reminders that happen to you when you're making a decision that's not in line with your values. And if you do that, it will be a challenge for you for a long time, because you'll look back and wonder, why in the world did I make that decision? I wouldn't have made that decision any normal day. Why would I have made that decision now? And so constantly thinking about what is important to you, what your values are, and holding tight to those even in times of crisis. So this is a lot of kind of general stuff that I have spent a lot of time thinking about. I do appreciate the opportunity to do this forum, because it's given me an opportunity to really look back and think about what's happened over the last 4 months, and how we as an organization have really moved forward. And it's a lot about leaders, but it's much more about all the people in the organization, and how we've all come together and really tried to do the right thing for our patients and our staff. So thanks so much.
Thank you, Dr. Brennan. I have a couple questions for you. You've made me think too, and I appreciate you sharing all of your thoughts and kind of the process that has happened over the last couple months for you and for hospital leadership. So I had, my first question was, you've been the Chief Medical Officer for almost 10 years now, but I assume that you've also gone up through different levels of leadership in the past. And I'm curious if there were any early lessons that you could, or examples of things you learned about leadership early on that you want to share with people who are at, lower or middle levels of leadership here.
Yeah, I would say a couple of things. I would say the value of a mentor has been really important to me. I had a mentor a long time ago who as we would have our routine one-on-ones, he would designate a certain time period just about my mentorship. And it wasn't really even about me growing to be better in the role I was in. It was about me growing to be better overall. And I think, that's kind of the way I see academics, that, we want to make people better than they wouldn't have been if we hadn't been a part of their journey. The other thing, had another thing that was on the tip of my tongue. I mentioned it a little bit during the forum. It is being flexible. I think we all have our own areas of expertise and skill, and we think that once we've come to a decision that, boy, that's it, and we're just going to move it forward. And I think that it's really important as a leader to recognize that, you may have expertise, but you also have people around you who bring different perspectives and have different expertise, and be able to just step back and, in an unbiased way, evaluate what's in front of you, and be able to pivot and really change course if that's the right thing to do. That was a hard one for me, because you think, a leader should be strong, right? And should be someone that, can really push through, even if there's, controversy or there's disagreement. But I think those times of controversy and disagreement, I think, are really good times for us to step back and really be thoughtful.
Excellent. Thank you. There's nothing quite like this pandemic to teach us to be flexible, I guess. The other question that I wanted to ask was, just you touched on the importance of self-care. I wondered, do you have any favorite small or big things that you like to do to unplug at work or outside of work?
I have started to be a gardener. I actually put in a garden last year, which was kind of a big deal because we live outside of town, so there was deer to deal with and things. But I find that going out there, whether it's gardening in the vegetable garden or even in the flower garden, and I'm just spending time with, nobody, or maybe just like my earbuds and, some good music is really helpful. During COVID, I actually have started doing some crafts that I used to do when I was younger. Some painting. I've done some paint by numbers. I've told my team this, that I kind of feel like, a kid that's doing paint by number. But it has been really fulfilling to me, because you can start with, a blank canvas with a lot of numbers on it. And when you get to the end, you have a picture, and, depending how good you are, which I'm not very good, it turns out great or not, but you see something. So you go from really seeing nothing to seeing something. And now I'm teaching myself to crochet. So it'll be interesting to see. It's not the easiest thing. I thought it would be a little easier. I think these are things that I mentioned a little earlier, that I would come home at night. I would, it'd be late. I'd eat. I'd go to bed thinking about COVID. I'd get up the next morning. I'd think about COVID. It just was almost consuming. And I started to force myself to go in. I have a separate room that I go to and do some crafting, and really found it to be really not only relaxing, but just invigorating almost, that I was doing something that was different and I had an outcome to it. So I think I would encourage people to think about the things that maybe are on your bucket list, or things that you used to do, maybe that you've gotten away from, that, can help to ease your mind.
Excellent. Those were really fun, great examples. So thank you so much, Dr. Brennan. We appreciate you sharing practical advice we can all take to respond to the coronavirus. I want to tell our listeners and viewers, please feel free to check out our previous wellness forums and additional resources on the Loop. And until we see you again, take care. Thank you again, Dr. Brennan.
Thanks so much. Y'all be safe.